Well, and probably the most frightening picture we can see, super-refractory status epilepticus. You touched on the importance of finding the etiology. If we not find the etiology, it's very hard to have a good result. And many times when facing patients with super-refractory status epilepticus, we have this clinical picture of new onset refractory status epilepticus, or NORSE, patients with no previous history of epilepsy and a very severe presentation of status epilepticus, refractory or more often super-refractory. There are very limited data on the treatment, on the management of these patients. A recent consensus suggested some points of investigating and treating these patients. What are your views on this, on treatment of NORSE and FIRES? Tell us something about, first of all, the difference between NORSE and FIRES, and how would you manage these patients?
Yeah, so I think that there's been a lot of overlapping terminology in the literature that some of the recent consensus statements have tried to narrow a little bit. So the idea now is that NORSE, new onset refractory status epilepticus, is the overarching subtype of continuing status despite several medications. And then FIRES is a subtype where you've had recent febrile infections and you don't find another etiology and you think it may be related to immune mechanisms underlying. And then there are other descriptive terms we can apply, like super refractory and prolonged and things like that, for status that goes on days or weeks with different levels of anesthetic use. But the idea is that FIRES is a subtype of NORSE. And a key theme, I think, for why people have tried to redefine these terms is that they shouldn't be exclusively retrospective diagnoses that we make weeks later after all of the testing we could possibly do is back. They should be early diagnoses because that will let us think about pathways, even as some testing is still returning, for how we treat more aggressively early in the course. And like you said, these consensus statements, I think, provide a nice pathway for things that we should think about early, like immune therapies, the keto diet. If we're going to do those things, they will probably be more effective if we implement them over days to a week than after the patient has been in super refractory status for weeks or months.